Over 60? 5 science-backed exercises that fix back pain better than walking. When you cross 60, something subtle begins to change in your relationship with your body. Movements that once felt automatic now demand awareness. The lower back, in particular, becomes a quiet negotiator. It whispers in the morning when you rise from bed. It stiffens after long sitting. It tightens after chores that once felt effortless. Many people believe that walking is the ultimate solution. And walking is excellent. It improves circulation, supports heart health, and keeps joints moving. But when it comes to fixing persistent back pain after 60, walking alone often isn't enough. Back pain at this stage of life usually isn't caused by one dramatic injury. It is the result of years of small imbalances. Muscles that were once strong have weakened. Others have become tight from sitting. Discs have lost hydration. Posture has gradually shifted forward. The spine itself is not fragile, but it needs support. And that support must come from the muscles around it. Science consistently shows that targeted strengthening and stability exercises reduce chronic low back pain more effectively than general activity alone. The reason is simple: walking moves you forward in a straight line. It does not deeply strengthen the muscles that stabilize the spine. It does not retrain posture. It does not correct muscular imbalances. After 60, the goal is not to push harder. The goal is to move smarter. The first exercise that consistently outperforms walking for reducing back pain is the modified dead bug. This movement may sound strange, but it is one of the most researched core stability exercises in rehabilitation science. The purpose of the dead bug is not to exhaust you. It is to teach your deep core muscles how to stabilize your spine while your arms and legs move. When you lie on your back with your knees bent and feet lifted, you create a neutral spine position. From there, slowly lowering one heel toward the floor while maintaining a gentle abdominal brace activates the transverse abdominis. This deep muscle wraps around your midsection like a corset. As we age, this muscle often becomes underactive. When it weakens, the lower back absorbs more strain during everyday movements. Studies in spine rehabilitation journals show that core stabilization programs significantly reduce chronic low back pain compared to general exercise alone. The key is control. The movement must be slow. The lower back should not arch away from the floor. Breathing should remain steady. For someone over 60, this exercise rebuilds confidence in spinal stability. It teaches the body that movement does not have to equal pain. Over time, daily activities like lifting groceries or getting out of a chair feel more secure. The second exercise is the glute bridge. If you look at posture in many older adults, you often see the hips slightly forward and the upper body leaning ahead. This posture places stress on the lumbar spine. One major reason is glute weakness. The gluteal muscles are the largest muscles in the body. They are designed to extend the hips and protect the lower back during movement. When they weaken, the lower back compensates. That compensation leads to chronic tension and discomfort. The glute bridge directly retrains the hips to do their job again. Lying on your back with knees bent and feet flat, gently press through the heels and lift the hips until the body forms a straight line from shoulders to knees. Hold briefly, then lower with control. The key is not height but activation. You should feel the work in your hips, not your lower back. Research consistently links glute strengthening with improved lumbar spine mechanics. When the hips regain strength, the lower back is relieved of excessive workload. Over time, pain decreases because the body distributes force properly again. Compared to walking, which uses the glutes in a limited range, the bridge isolates and strengthens them in a controlled manner. That precision makes the difference. The third exercise is the bird dog. This movement combines balance, coordination, and spinal stability. It is particularly powerful for older adults because it challenges multiple systems at once. When you position yourself on hands and knees and slowly extend one arm and the opposite leg, you create a cross-body stabilization pattern. This pattern is crucial for everyday activities like walking, climbing stairs, or carrying items. The bird dog activates the multifidus muscles along the spine. These small muscles are often overlooked, yet they are essential for segmental stability. Research from spine biomechanics studies shows that the bird dog produces high activation of spinal stabilizers with minimal compressive load. That means it strengthens without straining. For someone over 60, protecting the spine from excessive compression is essential. The bird dog achieves this balance. The movement should be slow and controlled. The hips should remain level. The gaze should stay downward to maintain neck alignment. Over time, this exercise improves coordination and reduces microinstability in the spine. Pain often decreases not because something dramatic changed, but because the spine finally feels supported. The fourth exercise is the side plank variation. As we age, lateral stability often declines. Many people focus only on forward and backward movement. But the spine must resist side bending as well. Weakness in the obliques and lateral hip muscles can lead to subtle shifts in posture that increase strain on the lumbar area. The side plank, modified for knees if needed, trains these lateral stabilizers. Even holding for 10 to 15 seconds builds endurance in muscles that walking rarely challenges deeply. Clinical rehabilitation programs frequently include side planks because they strengthen the quadratus lumborum and obliques, which play key roles in spinal alignment. Improved lateral strength reduces asymmetrical loading of spinal joints. For older adults, this means fewer sudden twinges when reaching sideways or stepping off uneven ground. The fifth exercise is the hip flexor stretch combined with thoracic extension. Back pain after 60 is not always about weakness alone. Tightness in the front of the hips from years of sitting can tilt the pelvis forward. This tilt exaggerates the arch in the lower back. At the same time, stiffness in the upper back reduces overall spinal mobility, forcing the lower back to move more than it should. A gentle half-kneeling hip flexor stretch opens the front of the hips. When paired with a slow chest lift and upper back extension, it restores balance to the entire spine. Research on posture correction shows that addressing both strength and flexibility produces better outcomes than strengthening alone. The body works as a chain. When one area is restricted, another compensates. By lengthening tight structures and strengthening weak ones, you create harmony. Now it is important to understand something clearly. None of these exercises should cause sharp pain. Mild muscle fatigue is normal. Discomfort in unused muscles is normal. But sharp or radiating pain should always be evaluated by a healthcare professional. The goal after 60 is sustainability. Performing these 5 exercises 3 to 4 times per week often yields better results than walking daily without targeted strengthening. Consistency matters more than intensity. Many older adults fear exercise because they worry about worsening their pain. Ironically, avoiding movement often increases stiffness and discomfort. The spine thrives on controlled motion. It requires circulation, muscular engagement, and gentle challenge. Walking remains valuable. It supports cardiovascular health and mood. But if back pain is your primary concern, walking should complement a structured strengthening routine, not replace it. Another factor that cannot be ignored is breathing. Deep diaphragmatic breathing enhances core stability. The diaphragm works together with the transverse abdominis and pelvic floor to create internal support for the spine. Practicing slow nasal breathing during exercises improves effectiveness. Sleep quality also influences back pain. Poor sleep increases pain sensitivity. Gentle evening mobility routines combined with proper mattress support can significantly reduce morning stiffness. Nutrition plays a role as well. Adequate protein intake supports muscle repair. Hydration maintains disc health. Vitamin D and calcium support bone integrity. Back pain after 60 is rarely a single issue. It is a combination of muscular weakness, joint stiffness, posture changes, and sometimes fear of movement. These 5 science-backed exercises address the root causes rather than masking symptoms. Progress will not be immediate. Improvement often comes gradually. Many people report subtle changes first. They stand taller. They notice less stiffness after sitting. They wake up with reduced discomfort. Over weeks, those small changes compound. It is also helpful to track your progress. Notice how long you can hold a side plank with good form. Notice how stable you feel during bird dogs. Observe how your hips feel after consistent glute bridges. Improvement builds motivation. If you have existing medical conditions such as osteoporosis or spinal stenosis, modifications may be necessary. Consulting with a physical therapist can personalize your routine. The body after 60 is not broken. It is adaptable. Muscles respond to training at any age. Numerous studies confirm that older adults can build strength and reduce pain with appropriate exercise. What matters most is beginning. You do not need fancy equipment. A comfortable surface, patience, and attention to form are enough. Back pain does not have to define this stage of life. With targeted movement, you can restore strength, stability, and confidence. Walking keeps you moving forward. These exercises rebuild the foundation beneath you. And when the foundation is strong, the spine feels supported, protected, and capable again. The journey toward a healthier back after 60 is not about returning to your 20s. It is about building resilience for the years ahead. Small movements. Consistent effort. Science-backed strategy. That is what truly fixes back pain better than walking alone. As you move into the final stage of this journey, it becomes clear that back pain after 60 is not a mystery and it is not a life sentence. It is a signal. A signal that certain muscles need attention. A signal that posture has shifted. A signal that the body is asking for intelligent movement, not just more movement. Walking will always be valuable. It keeps you independent. It supports the heart, lungs, and mind. But when it comes to correcting the mechanical causes of back pain, precision matters more than mileage. The 5 exercises you have learned: core stabilization with the modified dead bug, hip strengthening through glute bridges, spinal coordination from the bird dog, lateral stability with side plank variations, and mobility restoration through hip flexor stretching combined with thoracic extension, work together as a system. They do not compete with each other. They complement one another. That is the real science. Back pain rarely comes from one weak muscle. It comes from imbalance. One area tightens. Another weakens. The body compensates. Over time, compensation becomes discomfort. Discomfort becomes fear. Fear reduces movement. Reduced movement increases stiffness. And the cycle continues. Breaking that cycle requires understanding. After 60, muscle mass naturally declines in a process known as sarcopenia. Bone density may decrease. Connective tissues lose elasticity. But here is the part many people do not realize: strength training slows and even reverses much of this decline. The nervous system adapts. Muscles grow stronger. Balance improves. Pain sensitivity decreases. Scientific reviews consistently show that structured strengthening programs reduce chronic low back pain more effectively than passive treatments alone. Movement is medicine, but only when it is purposeful. Consistency becomes your greatest advantage. You do not need long workouts. 15 to 20 minutes, 3 to 4 times per week, is enough to create change. Quality matters more than duration. Slow repetitions. Controlled breathing. Proper alignment. It is also important to respect recovery. After 60, recovery is just as important as effort. Adequate sleep allows tissues to repair. Gentle mobility on rest days keeps stiffness away without overloading the spine. Posture awareness throughout the day amplifies results. When sitting, keep both feet grounded. Lengthen through the crown of the head. Avoid collapsing forward. When standing, gently engage the abdominal wall and glutes without gripping tightly. These small adjustments reduce cumulative strain. Confidence is another powerful factor. Many older adults limit movement because they fear damaging their spine. In reality, the spine is remarkably strong. What it dislikes is unpredictability and weakness. When you build stability through targeted exercise, you teach your body that movement is safe again. That shift in mindset often reduces pain as much as physical strengthening does. Hydration supports spinal discs, which rely on fluid balance to maintain cushioning. Adequate protein intake supports muscle repair. Gentle daily activity keeps blood flowing to healing tissues. Pain that persists or worsens despite exercise should always be evaluated by a healthcare professional. Conditions like severe spinal stenosis, fractures, or nerve compression require medical guidance. But for the majority of age-related back discomfort, structured strengthening remains one of the most effective long-term solutions. Remember that progress is not always linear. Some days you will feel stronger. Some days stiffness will return. That does not mean you failed. It means the body is adapting. Continue with patience. Continue with control. Over time, you may notice unexpected benefits. Improved balance while climbing stairs. Easier transitions from sitting to standing. Reduced fatigue during daily chores. Better posture in photos. Greater confidence when traveling or playing with grandchildren. These are not small victories. They are signs of restored function. A strong back after 60 is not about aesthetics. It is about independence. It is about the ability to carry groceries, garden, cook, travel, and enjoy life without constant hesitation. Walking will still be part of your routine. It should be. But now it becomes the complement, not the primary solution. You are no longer just moving forward. You are moving with support. The 5 science-backed exercises form a foundation. A foundation that stabilizes your spine, balances your hips, improves coordination, enhances mobility, and rebuilds strength. And when the foundation is stable, pain loses its grip. Age does not eliminate your ability to adapt. It simply requires smarter strategy. Move with intention. Strengthen with patience. Breathe with control. Recover with respect. Your back is capable of resilience at any age. The decision to begin, and to continue, is what transforms discomfort into strength and limitation into freedom. This is not the end of the journey. It is the beginning of a stronger chapter.